Hey everyone, welcome to the workshop tonight. I'm Dr. Tiffany Jones.
Dr. Mike Bucknell.
Dr. Jordan Moore.
And tonight we're going to be going over an update on COVID. We're going to be talking about things like mandates and changes in statistics and other interesting and important information regarding the ongoing pandemic. Dr. Mike, if you'd like to lead off, you can go right ahead.
Sure. So, obviously, looking at the current status of things, nobody here, I'm going to start with this. Nobody here is doubting that anybody gets sick. Okay. That's not the question. That's, we of course know people that have gotten sick, just like, get sick from the flu and other things every year. This is not any different. People get sick. So that's not in question. The question is the degree of manipulation within the media and within everything that you hear, driving this to an absurd level that is really beyond any imagination right now. I found just looking at the simple issue of, are the vaccines effective, right? Because that's where right now everything is steered at. The reason why you're going to continue to hear this, you go back to our early discussions on this. We talked about it, a year and a half ago, that this is where we were going to be when this time came. I mean, we didn't need tinfoil hats. We needed magic balls, right? To show, we knew the future. We knew where it was going. No, I mean, it's a book. This is a children's book, if anything. So, the rhetoric right now is that everybody needs to get the vaccine in order for the pandemic to end, right? It's not going to end until everybody gets it. Well, the reality is 56% of Americans have gotten fully vaccinated. It's literally half, so they make it sound in the media like it's only the outliers left that haven't gotten it, but it's really half of America hasn't gotten it. So, but this idea that the vaccine is completely safe, there was a leaked Department of Defense document revealing evidence of widespread vaccine failure. Listen to this. So this was October 5th. So this was exactly 1 week ago. A leaked Department of Defense document first reported on renslaw.com by attorney Tom Rentz reveals high rates of breakthrough infections, 4% of which died, and hospitalizations within a cohort of 5.6 million Medicare beneficiaries, all of whom were fully vaccinated. Okay, so an astounding PowerPoint document posted on the Humetrics company website titled Waning Effect of COVID-19 Vaccines in a 5.6 million U.S. study cohort, weekly update 9/28. Stamped by the Department of Defense Joint Artificial Intelligence Center's Project Salus. Okay, it reveals that the COVID-19 vaccines are clearly not living up to their stated promises of being highly effective, something that should be obvious to anyone watching the aggressive push to add regular boosters on top of a failing 2-dose regimen. It says within a cohort of 5.6 million Medicare beneficiaries aged 65 and older who received 2 doses of the COVID-19 vaccines, 2.7 million were the Pfizer and 2.9 million the Moderna, there was still a cumulative breakthrough rate of 2.9%, along with a 21% hospitalization rate within those breakthrough infections. Among breakthrough hospitalizations, 31% of those required ICU care, and there was a 4% death rate overall among the breakthrough infections. So, being told that this is, completely safe and effective is obviously a complete overreach because, initially we were told it was going to cure it. It doesn't. The Pfizer vaccine, they just came out and they said this was like a week ago, that the effectiveness after 4 months is down to like 54%. So, but now you need to go and get a booster shot. Well, that leads to the obvious question, how many booster shots are you going to need? And I think the answer is pretty clear. Well, you're going to need one every year, just like the flu shot. So, my question to anybody that's gotten the vaccine is, are you going to line up every year and put another needle in your arm for something that, they told you initially, one and done? It makes no sense.
So that's interesting. In terms of the vaccine itself, when we talk about effectiveness, I like to look at the stats of actual death rates from COVID itself. And I looked at, the total cases in the U.S. versus the total population. We had about 7% of the population counted as a case. And, some people had multiple cases of COVID, and some never had any. And I think that speaks to a lot of lifestyle factors. When I talk about degrees.
Also driven by contact tracing.
Yeah. But, degrees of separation, when I think of myself and my husband, neither of us have been sick at all, let alone with COVID in the last almost 2 years. And I think that speaks to styles of prevention. But when we talk about death rate, the state of Alabama had 14,859 deaths. And when you compare that to the population in Alabama, that's about 0.3% of our total population. So if we're having higher rates of, vaccine issues and reactions, I'm curious why it's been marketed so heavily that this is the saving grace when, you're almost better off just getting COVID.
Yeah, definitely better off. I mean, they have clearly shown that one study showed 13 times greater immunity with natural immunity that was lasting than what you get through a vaccine. 13-fold.
Yeah, who'd have thought that?
Right.
But you did mention the effectiveness of the vaccines. It was heavily marketed that they were 95% effective, 94% effective, Pfizer and Moderna, respectively. And I want to address relative risk reduction and then the absolute relative risk. So the 95% that's been quoted, it's the relative risk. And then in reality, the Pfizer have the stats here. It's 0.7% absolute risk reduction. And what that means is you take a population of 10,000 and expose them all to the same, whatever you want to expose them to, the same virus or the same variant in the experiment, and only a certain percentage of those will get the active infection. And then if you were to take that same group and then inoculate all of them and then see the percentage of people that got COVID after that, then you could see, you compare the two different percentages, and that gives you your relative risk. Now I want to talk about the absolute risk reduction that I mentioned, that 0.7 for Pfizer. That implies that in the control, or in the experiment that they did, out of the 10,000 people or however many people they tested, only a very, very, very small amount of people even got sick in the first place without the shot. And to tell people that you're 95% protected, it's simply a lie, because it's the relative risk. It's not the whole story. And the people who did this study as well were financially motivated to have a successful trial. And I think it's disingenuous, and you should question if you're being fed only half the story by the people who need to give you the treatment. And it's just something to consider, because I know recently people are now talking about absolute versus relative risk, and both sides have sort of an agenda. You need to have both of these stats for the entire picture. And neither of us are statisticians or anything, but it insinuates that your risk of catching this virus with exposure, and with any virus you have to have lengthened exposure or one massive exposure and a weakened immune system with each other to become symptomatic and actively infected. And to say this shot is 95% effective for everybody is completely false. It's a fear tactic.
And I think it would speak a lot more to, the media's push for the vaccine and the government's push for the vaccine if they had also, free of charge, been offering vitamin D supplements and vitamin C and, preventative things at the beginning of this pandemic to prevent transmission and illness and deaths for free, right? If we were really concerned about, we'd have done everything possible. And I think we even talked about this, the last time we talked about COVID. Where was that push? Where was that huge media blitz of come pick up your vitamin D3 supplements from your health department? And,
no, let's close the beaches.
Yeah.
The gyms as well.
Wear a mask
In the middle
outside
of
of the park because open air is dangerous. Wear it walking to your table.
Do you remember
in
when
the
they
restaurant.
said that you could catch it through your eyes?
Yeah.
So,
I do.
So arguably, if a face mask works, wouldn't wearing sunglasses work? I mean, it's actually a more solid substrate,
Yeah.
so
Make it
they
make
should have
sense.
said, just make sure you're wearing sunglasses
Yeah.
or safety glasses.
Well, we talked about the side effects for the vaccine, what we know of, and I know I've had a patient, one that spoke to me just last week. He got the shot, and 3 days later was having, and he was training for a race, a pretty big one, and he got the shot 2 weeks before. 3 days later, he started having symptoms of myocarditis, and couldn't walk to his truck without his pulse rate getting elevated pretty substantially. Can't train anymore. The race is written off, and there's no clear explanation why he got this symptom. And I know you've had patients. I'm sure you have too. And that's just one symptom that can be observed right now.
Mm-hmm.
And 3 days later, that's pretty immediate. Who's to say? And neither, my patient didn't report to VAERS. I'm not sure if y'all's have, but
No.
So the amount that have reported to the government or to VAERS, it's massively underreported.
And I actually have some stats on that. I'm glad you brought that up. So, worldwide, the number of adverse reactions reported for COVID vaccines was 778,000 from December of 2020 to October 1st of this year. In all other vaccines from 1990 to now, they reported 824,000. So we're almost at the total number of reports for the last 30 years, 31 years. And I think part of that does lie in the media exposure for the vaccine, right? Everyone's much more aware that this one is newer and, there's something to watch out for, and it's very polarized. But even still, before then, the number of reports to VAERS for adverse reactions of small significance and life-threatening significance was less than 1%. And a lot of times that's because patients feel like their clinician doesn't take them seriously. Clinicians even can discourage patients from wanting to report because it causes them more paperwork to report. And a lot of times reactions are discounted because it's just a fever or just being fussy or, your arm is just sore. So it was pretty interesting to see that, though. Let's say we even had 25 times the amount of reports to VAERS. That's still a pretty significant number when you consider how many actual reactions may have occurred. But I was even looking into issues with women's menstrual cycles. There is what's her title? A human reproductive ecologist in the North. In North USA, she had an abnormal cycle after receiving her first dose of the COVID vaccine. And she talked to a colleague who also had weird symptoms with her menstrual cycle. And they just asked a question on social media about it and received like 140,000 reports of women who had menstrual cycle issues. Now, what seems like, fortunately, is that these symptoms that were abnormal for them lasted only a couple cycles. But what is abnormal for a menstrual cycle? A lot of times your stress level can be what throws you off, but we don't know the long-term effects of really any medication. So it's interesting, to see that discounted and blown off as, well, since literally anything can throw off your cycle, this is not a big deal either.
Right. Well, and, to make it clear too, the hospitals and physicians, they're not reporting either. It's not just, you can pretty much guarantee most of those reports are coming from individuals, like you said, who weren't necessarily listened to. Mm-hmm. It's not coming from doctors and hospitals because they don't report it. There's actually, I think Project Veritas it was that posted videos of them talking inside a hospital saying, oh yeah, they don't, this was in a federal funded hospital and they said they do not report. Mm-hmm. They will not report anything when it comes to side effects, but they see it all the time. There's constantly side effects. and they won't say anything about it. That's just crazy.
It's
Yeah.
almost become we said this last time, almost a religion. If you you don't want to do anything to discount your own religion, a lot of people won't. So if you feel like reporting something to VAERS as a physician, could discount the cause or make people, be pushed away from getting the shot, and you believe the shot saves lives, then you won't do it.
Yep. So, and there's this convenient term now, misinformation. Mm-hmm. And that's the irony of the entire thing. If you believe anything of that with misinformation, it goes both ways with exactly what you said. You can't just call off evidence either way as misinformation, but that it's definitely weighted in one area. I mean, when you've got Google and YouTube, which are the same, and Facebook, and everybody going after and banning anything that has to do with what they deem misinformation, there's a problem. Mm-hmm. There's something massive going on. So. Yeah. Going into mandates and stuff with all this, because this is a massive concern. I mean, I think we've kind of hit that it's basically a 50-50 split now, which is funny, it's kind of politically about the same. So they say, let's not make this political, but it's pretty interesting how there's that polarization of it's about 50-50 toss up. But these mandates are affecting people from all walks, and if they want it or not. And so you have, areas like California and New York who are pushing these mandates first and before anybody else. Mm-hmm. California, I saw, just made it to where somewhere in California, I think Los Angeles, where kids are going to be required to take the COVID vaccine in order to be in school. So you're going to have a mass exodus into homeschool. That's not that different from here. I hate to say it because our superintendent, who we've had many discussions with, it's outlawed that you can have, any kind of vaccine passport in this state, in Alabama. However, they still thought it was reasonable to send out a survey to all parents in regards to the face mask, asking, one, what is your thoughts on the face masks, if they should continue to wear them? Two, are all adults, parents in the household, fully vaccinated? 3, are all children above the age of 12 fully vaccinated? And 4, are any other adults that are in your household fully vaccinated? And, the question is, what business is it yours? You have no basis to ask those questions. It literally flies in the face of the vaccine passport legislation, and we let them know that. But, in even the more liberal areas like New York, this actually just came out today, that a federal judge on Tuesday ruled in favor of 17 New York State healthcare workers who object to religious reasons to getting a COVID-19 vaccine. The judge said defendants, state officials, failed to adequately explain why workers were denied from religious exemptions to a vaccine mandate imposed in August. It was a 27-page ruling. So this stuff is going through the courts right now. And, I had a patient today that said, that her husband works at Ingalls, and that they are literally, like, by next week required to get it, or they are told that they're going to lose their job, they're going to lose their retirement and everything, and same thing with the military. There's literally hundreds of thousands, they say in the news, hundreds of thousands that have not followed through and gotten the vaccine, and they're looking at a dishonorable discharge. How are you going to dishonorably discharge hundreds of thousands of military members? We won't have a military left. Mm-hmm. So I guess the biggest thing I can say at this point is drag your feet as much as you can. Drag your feet, and if necessary, you may have to determine if you're going to keep that job or not. But as for me, it would be a no way.
It speaks to the weariness that this pandemic has created with the media, because going back to the form the school sent out, the audacity to ask about vaccination status as if that prevents transmission. It's not even preventing transmission. And
Nope.
And we're using this as the this fixes everything.
Yep, the
don't
patch.
don't take care of your body. Don't eat well and exercise. You just need the vaccine. Just quiet down and get your vaccine.
And all will be well, except it's not.
It's so frustrating.
So, to go on that, that goes kind of hand in hand with that. You guys have all heard about where all this started with the big companies. 100 employees or more was according to Biden's executive order, right? That he said that any company over 100 employees would be required to enforce the vaccines for their people. Okay? Well, this is curious. October 5th. This was, again, last Tuesday. Executive order commanding all U.S. companies with more than 100 employees to mandate the COVID vaccine for those employees. I can't find the executive order. I don't see it in the Federal Register where it's supposed to be published. If it hasn't been published, then there is no mandate. If there is no mandate yet, then obviously none of the companies are under any obligation to enforce it. OSHA is apparently the federal agency responsible for framing a set of regulations for the mandate, including fines. But federal agencies only construct regulations after a law has been passed or an emergency executive order is issued. If I'm correct and no executive order has been published, we have an odd situation, to say the least. Governors and lawyers have been threatening to sue because the EO is unconstitutional and overrides state powers. But if there is no presidential EO, then all these legal cases would be meaningless because, again, there's no official mandate. So he got on TV, apparently, and said in front of everybody that there was an executive order that he signed in order to make all this happen. But nobody can find it. Mm-hmm. It's not published. So basically, this goes perfectly in line with everything else that they've done, where they want you to think, for example, you're getting an FDA-approved vaccine. No, you're not. There is no FDA-approved vaccine. It's a lie. The FDA-approved vaccine was one that is not in production. The one that is being used right now is the one under the executive order. But people are going and getting it thinking that it's FDA approved, so it must be safe. No, it's not. They do that because they want you to be on your own merit. They want you to get it because of something you misinterpreted, because then they can't be liable. So if they put out this executive order but they don't actually publish it, then they don't have any liability with it. Now companies assume that liability on themselves when they enforce these things. And so what it means is there's going to be a disaster in courts for the next probably 5-10 years of people suing companies for, and I guarantee you there's going to be massive mistakes, and people are going to have all kinds of documentation to back them up. It's going to be a slaughterhouse.
You're meaning that the current round of vaccines that people are getting are the emergency authorization,
right?
Versus,
right.
It's like the day it got approved for FDA, people were thinking that the shots they were getting the same day were. It's not those doses were approved under emergency authorization,
and it's still not.
Mm-hmm.
They have millions of unused doses. They are not plain and simple. They're not going to give people the FDA approved vaccine. They won't. Because with that comes risk, liability risk. Mm-hmm. So they literally played the perfect card to protect themselves. Who do you think can afford the best attorneys? So it's a shot in the dark if you take it.
Yeah, and I know America's Frontline Doctors talked about, the reproductive risks as well, going back to female issues, and risk of miscarriage. And COVID also carries a risk of miscarriage, if the body doesn't think it could support a baby at the time. But the thing was with the risk of miscarriage from the COVID shot is it continued months after months. And some people still have those side effects from the vaccine they got.
And with blood clotting issues, placenta viability is a concern. It's scary stuff.
To be recommending this to anyone. I know males, especially young males with the myocarditis, and then for pregnant women, to recommend something that has the potential to cause clotting issues while they're trying to develop a fetus and establish a proper environment for a child, it's irresponsible, very irresponsible.
So we should probably take a minute then and discuss things not that we prescribe or suggest to treat COVID, because we don't do that. We don't treat COVID as chiropractors. But things that we've heard that patients have done that they found success with. That, so we're just basically passing on information on what can be done. One of the big things that I know has been highly successful for a lot of people has been, and some have recommended, I think the frontline doctors, they were recommending that you nebulize hydrogen peroxide. That was a relatively new one. I know someone that was doing that and, stayed sick for about 4 weeks. But once they started nebulizing silver, not colloidal silver, but silver nano solution, they started recovering within a matter of days. I'm talking a couple of days. Their blood oxygen saturation went from 80 up to around 90. So that's been a big one. I don't like medications, of any kind, but I also know a couple of other people that got prescriptions for albuterol, and when their blood oxygen level was low, they used the albuterol, which of course is an asthma treatment, and that opened up their lungs, which allowed, of course, silver to do more of what it needs to do, and their oxygen levels went up as well. You mentioned, of course, you mentioned vitamin D. That's kind of a no-brainer. Not a standard dose of 5,000 IU's, but
right, a little bit elevated based on your body weight is what
that
I've heard.
up.
Yeah.
I know patients that have done 40, 50,000 IU's a day. That's no issue whatsoever. Vitamin C. I think that was mentioned. That's a big one. Zinc, of course, everybody talks about zinc because that rebuilds epithelial tissues, so it helps rebuild the lungs and everything. And
not on an empty stomach though.
Not on an.
I've learned that lesson.
Make you feel bad.
And the liquid stuff doesn't taste so good all the time either. Another one mentioned was blood clots, and this is of course. That issue seems like it's only been the last few months that has become really a known issue, which begs the question how much of it has to do with, so much the vaccine related issues or the sickness related issues. But either way, you look at blood clots, there's a lot of doctors that are now saying that if you use a blood thinning agent like aspirin every day. But curiously, there is a product called Nattokinase in the natural realm, which does the same thing. But what it does is it effectively thins the blood by breaking up protein debris and buildup in your arterial system. So if you have blood clots and such, I have a patient that at one point had a big blood clot in his arm. You could see it. He started taking nattocerezymes by Designs for Health. And a week later, he actually showed me, he lifted his arm and the blood clot just sank. I mean, his vessel was still distended, but it had completely just dissolved the clot. So if clotting is a concern, then it seems that might be an effective measure as well.
Yeah. And I want to hit home. I talk a lot about, the prevention of getting to a point where your body is susceptible to illness. But waiting until you're sick to take massive amounts of vitamin D and zinc is really not the move. You want to make sure that you're getting these things in your diet and holding on to a good blood level, especially of vitamin D. I mean, we know in all the years past, when it starts to get cold, flu season comes around, we're outside less. Our vitamin D levels drop a little bit. So that's...
they had said early on, I don't remember where it was said, but I remember seeing if everybody got something like 2,000 IUs of vitamin D a day, that we would cut the death rate of COVID by some 95%.
Mm-hmm.
It's a no-brainer.
Yeah, it's definitely, yeah.
That's really not that big of a dose.
No.
2,000 IUs.
No,
Yeah.
I think
2,000.
I take that.
Yeah.
I think I take 5 or 10 a day,
Yeah.
and that's
5,000
nothing.
is kind of an average dose for an
Yeah.
average person, average size, but if you're sick, you can take 1,000 IUs per pound of body weight per day safely, according to the studies. Now, typically we don't, recommend that
No,
much.
yeah.
40 or 50,000 IUs is plenty if someone is actively sick,
Right.
and usually knocks it out fast.
And I thought it was interesting. They had mentioned, this affecting other ethnicities a little bit more, and it is worthwhile to note that, we could synthesize more vitamin D in a smaller amount of time,
Yep.
but we run the risk of potentially causing damage. There's a B vitamin, I believe, folate, by being in the sun too long, versus someone with darker skin would take longer to produce vitamin D, but they have more of a protective factor against too much sun for the folate issue. But yeah, that's important to know too, because everyone was saying that corona did affect other ethnicities a little bit more, and that might be why. It might be they have higher risk of vitamin D deficiency.
Mm-hmm. So I had just considered some of the mental health detriments too of all the vaccine talk and questioning, because on the internet now we see a lot of tags about misinformation. So anytime you're looking for information for yourself to make an informed decision, you run into, okay, well, this is just complete malarkey, and then you see your CDC recommended definitely get your boosters whenever we decide they're necessary. But last
That's a good
year,
point. What should we title this on YouTube? Because otherwise it's going to be
definitely not talking
next
about
week.
COVID. That's what we'll title it.
How to find the best hairspray.
Yeah. But so last year, this time we were 8 months, 7-8 months into the pandemic, so we were worried about COVID itself. Worried about who gets it, what populations are more susceptible, how to prevent, all those things before really the vaccine was talked about. But now we're seeing people who are worried about going back to work in the workplace and reestablishing routine that they had lost last year. Now, we're also seeing fear over guidelines and the rationale behind those guidelines and what we're going to do if we can't make ourselves ethically conform to those guidelines. But now we're also looking at fear of limited access to supplies, interruption to worker income if you are forced to leave your job, or if you have to, if your job fires you. But also the biggest one I've seen is the stigma around symptoms and illness. As a person with arguably just 24/7 allergies to the environment, if you go into public and you sneeze, God help you, But I think these fears are just as bad as what we're worried about with COVID in the first place. You're stressing your body out to a point where you are more susceptible to illness. So, how do
Remember
we...
when they showed that they actually determined that people that stayed at home, boxed up in their apartments and such in New York, were actually more likely to develop COVID than people that were out and about.
Yeah.
It goes hand in hand with that.
And we haven't addressed pathogenic priming and antibody dependent enhancement. The reason why we haven't had an mRNA vaccine prior to this year, and we've been studying it for decades, there's something called pathogenic priming, and it's really unknown if this shot causes it, but it's a phenomenon where you're getting a shot for a certain virus, or an mRNA for a certain virus, and it will heighten the effects of all other viruses.
And variants.
Yes, and variants. And we haven't seen enough, I guess, or haven't experienced enough to point our fingers yet, but I wouldn't be too surprised if we see that in the future.
Yeah.
Those that have naturally gotten sick, though, and I say naturally gotten sick, those who have gotten the virus in the first round, we know that they fight better against the variant, and they have longer lasting immunity. We already know that to be true, and it seems like the variant obviously is a little bit worse. The next one might be even more so, and so you can either continue getting boosters or, I hate to say, get the virus and have the natural immunity.
Well, if you look at a graph of
But that won't let you keep your job.
yeah,
No, it wouldn't. It wouldn't.
the graph
You can have natural immunity, but that's not good enough.
right
No.
doesn't meet the standard. Of the cases, daily cases, you see like a huge spike around April, May of 2020, and then it dipped way down, around January, and it started going back down, and everyone's like, see, the vaccines are working, everyone, get your vaccine. And then we had that huge breakthrough surge right around the summertime, which one is questionable because how do you have a breakthrough surge of cases when it's the most vitamin D rich time of the year, for one, but two,
That was
after months of people getting their
Respiratory illness
first,
of all things.
yeah, their first and second doses of vaccine have huge cases. So we've dipped back down and then risen a little bit again, and we're back at the bottom of, lowest cases we've had in probably 8 months now.
And I wanted to point out, we know Israel was one of the first countries that hit the vaccines hard, and they are suffering pretty heavily right now. And I want to compare them to Sweden. Sweden, who never shut down schools, who didn't implement as strict of mask mandates and didn't force I think they've actually paused the Moderna shot for anyone under 30 years old.
Yep.
For the risk of myocarditis. And I have some stats here for Sweden in the last few reported days, which was October 7th, 6th, and 5th. On October 7th, they've had, in the nation of Sweden, 3 deaths. On October 6th, they had a death. And October 5th, they had 2 deaths from COVID. Compare those to USA respective dates. We had 1,892, 2,200, and 1,955, or 1,955. And so I think Sweden did it right by avoiding the lockdown, keeping kids in school, telling those who were vulnerable to stay home, and they dealt with their first and second waves, so to speak. And now we're just now getting over our third hump with this virus, and meanwhile Sweden never had theirs.
Yeah.
I think that's important to know.
But CNN says don't pay attention to Sweden.
Yeah, they're
They're
superhuman.
too different.
Don't believe
different-
anything you
different
hear out of
humans
Sweden.
than us.
which is unique because it's a Scandinavian. It's up there, right?
Yeah.
In the way northern hemisphere
They
compared to
should
us.
have more
They should.
respiratory illness.
You would think.
Yeah, absolutely.
Yep, but when you lock down and don't expose your immune system to anything but what you're used to, you're going to be more susceptible.
Yeah. And not to go back and harp on that again, but that's of course a gigantic issue here at home is that our kids are still in face masks. Like you can go to football stadiums anywhere,
And sit
any
shoulder
weekend,
to shoulder with thousands of people.
and yet CNN says those are not what do they call it, mass spread events, or what is their term for it? They've got some stupid term for it. They say that's not an issue. But even though Saraland and Gulf Shores and Eastern Shore, Baldwin County, all of them have dropped their face mask mandates, Mobile County public school system still has not. Our kids are still, well, my kids aren't. My kids have a legitimate medical exemption. But all the other kids are in face masks. And it's terrible that they have to be chained watching my kid smile at the teacher. It's terrible. I mean, it's garbage, so we're fighting it every day, still fighting it, but we're, it's closer than we think is what we were told. It's closer than we think.
So I keep circling back to, the mental health aspect of that. But, kids nowadays with increased social media and technology use, their interpersonal skills are already at a disadvantage compared to my generation and generations before me.
Yep.
So now we're taking out facial expression
for
and
that.
interactions I didn't say you, but now, I mean, if you want to bring it up,
You said
Dr. Mike, you're
generations
older.
before you.
You're older.
So
But, you know, we're taking out facial expressions for that. Developmentally, how is that affecting our kids? You know, how are they, you know, you just grow up looking at people's eyes. Like,
Yeah.
there are people who started school not ever seeing their teacher's face.
Yeah.
Or unless it was on a computer screen, which is not that much better. It's astounding that we've stuck the least susceptible age group to illness in a room with face masks.
Yep.
Even so, I've
training.
got a first grade teacher, and she says, you can't keep the masks on the students. You know, you can tell them to put it back on, but they'll have to pick it up off the ground. Or
They're trading them out because they like the pattern
yeah,
better. Yeah,
they like their friends' masks because they'll switch for the day. I mean, they don't understand what they're doing. They just know to do it, right?
Mhm.
And
Yeah.
so that's another.
That's so sad.
Yes, it
That's
is.
so sad
Yeah.
because, you know, what that means is the parents aren't telling them either.
Mm-hmm.
Very
it's quite the
unfortunate.
situation, right? I mean,
Yeah. Well, and
sit
you
in-
even get to the thought, what happens when they do say, okay, remove the mask? I want to know how many kids just keep on wearing it because that's what they've done for the last year and a half. So anybody with social anxiety or depression or anger issues or are bullied or, you know, you name all these different things, they're probably still going to wear the mask
Mm.
because it allows them to hide themselves.
we're already dealing with that. I see parents talk all the time about their kids, you know, when they can take off the mask, they're still afraid to because they've been told this whole time that that's what protects you.
Yep.
So how do you make it, you know, make sense to a kid when you tell them, oh, now you've got this vaccine that doesn't prevent you from transmitting the disease, but take off your mask now, you're safe.
I did want to mention everyone talks about killing COVID. It's not alive to begin with, right? It's a piece of virus.
Who cares about that?
It's a well, I always hear like, oh, this kills the coronavirus or this.
Yeah.
That's I mean, bacteria you can kill, but viruses you can't, right? Because it's
Right.
bits of DNA encapsulated. But I want to harp on the push for sterilization and cleansing everything in the house. You know, people that will bring their bags home and spray everything. You know, change as soon as they get home.
Especially the spraying Lysol.
Mhm.
You're spraying a chemical irritant to your lungs heavily during a respiratory. That's just like smoking.
Known
Talk about
endocrine
smoking?
disruptors,
Yeah.
and we already talked about depression, gut. You know, we know that gut health as well. Anything that we eat or touch that has these chemicals as well goes into our body, can kill that as well, leading
Absorbed through
to
your skin.
right, and it does get absorbed through skin as well. So Purell, you know, anything you put on your skin gets absorbed, but the exposure to viruses and bacteria at a young age, so these kids need this exposure so their
Mhm.
body can take these viral particles. And we talked about in a previous video about viruses being your software update or your hardware update. Your body will take that, incorporate it into the DNA, and now part of your DNA is actually a virus. And we know now a lot of your DNA has come from viruses.
Which, curiously, we talked about this. It's been a long time since I don't remember which workshop we talked about this in, but it was a long time ago, many, many years ago, that they now know that viruses actually, getting viruses in the past, what was it? One said that if men who I think got the measles stood significantly less risk of dying of a heart attack.
Mhm.
And they also found the same thing, that they have significant reduced risk of developing cancer, to the degree that companies, you know, around the world are using viruses. My sister got one, you know, when she went for cancer treatment, where they train a virus in order to deliver, you know, some change to upgrade the software so that now your body kills the cancer cells. And they're studying all kinds of stuff like that.
And
so
we talked
spot
about
on.
I do remember that workshop as well, and we also talked about celiac and how they were putting the gene for digesting gliadin or gluten into a virus, you know, and injecting people, and then they have the ability to digest gluten. It's interesting. I don't know how I feel about it, but
Yeah.
it's fascinating to see us using viruses as a tool.
But people right now might get confused and say, "Oh, well, see, you just said all of these good things that the virus can be used. That's exactly what they're doing with the vaccine." No, the vaccine, they've told you what it does is it trains your body to produce the spike protein. So you're literally, it's like genetically modifying corn to produce its own pesticide,
Mm-hmm.
which is what the Monsanto corn does. It produces its own. So if your body is producing the very thing that creates illness, what do you think it's going to do? It's going to do what it's intended to do.
Yeah, and I wasn't pointing out that adding the gene to digest gluten was a good thing. I'm saying maybe we shouldn't play around with this, but it points back to the fact that viruses are taken up by the body, and we know mRNA can be taken up through reverse transcriptase and put into your genes. So
Yep.
Part of the shot does become you, essentially.
Yeah. Scary.
Yeah.
Any other points? Any other questions from anybody?
No, all good.
If anybody has any questions online, by all means ask. I hope we helped you to determine what the best hairspray on the market is available today. Unfortunately, we don't sell any of them, so you'll just have to go shop elsewhere. But in the meantime, stay vigilant.
Yeah.
That's
Keep thinking
the big
for
thing.
yourself. Yeah.
Dig.
You know your body.
Don't succumb to the threats, because the reality is you're still 50% of America if you are still on the side of saying no thank you. You're still half.
They'll make you feel like you're in the corner, but
Yeah.
They do.
Yeah.
They want you to think you are alone. You're not. I mean, it's 44% of America or something like that. That's a lot of people. So
And
as
I'd
long as they
argue
stay no.
even more would have, without familial pressure, and
Oh, absolutely.
would not have gotten it. There are many who've been coerced already into having the vaccine.
Yep.
Yeah. So you're not alone. Yeah.
All right. Have a great night.
Yeah. Thanks.
Night.